Hi there, just taking a quick break. Wanted to talk to you about an article that I wrote. I'll go ahead and attach that as well, but this is entitled, Why Do My Knees Crack and Pop When I Bend Them? So, why do my knees crack and pop when I bend them? Cracking, creaking, popping, all these grinding noises, most of the time pretty normal. It does happen as we age. Typically, it's okay as long as it's not affecting your flexibility, your range of motion, and especially if it doesn't cause any pain. So cartilage, you know the white shiny stuff that you see on the ends of chicken bones? Kind of gross, but as you break them apart, you see the white shiny stuff. That's the cartilage, and we have that around our knee bones and throughout all of our joints as well. And due to old injuries or even just from aging, that cartilage can kind of wear out and grind down and wear down. It leaves pits in them, and that right there might be some of the grinding or the gravelly sounds that you feel in there. Again, not that big of a deal, as long as it's not affecting you in any way. Ligaments, again, due to old injury, ligaments are those rubber band-like tissues that hold the bones together. So those ligaments can be injured, and again, they do stretch out over time. Pregnancy can be another cause for softened ligaments, and that might be another reason that it can do that. So again, if knees hurt or they're causing flexibility problems, that can be a problem. That will typically happen from injuries. So sports injuries, car accidents, slips, trips, falls, bad injuries that will tear up those meniscus, ligaments, and also in that cartilage that I was just talking about, sometimes you can get a little more of the pitting, you can get actual tearing. And with the tearing, the cartilage can leave little flecks, fragments, and those can chip off, and that can cause a lot of pain. So sometimes surgery is completely effective and appropriate for these types of injuries. You see football injuries where they're getting clipped from the side and just tearing things apart. I'm going to talk about cold laser therapy and Trigenics therapy in just a second, but for a knee that's like that, no, a cold laser will help, it'll be good, but those are cases where you really need surgical repair. So what are the other options for aging knees, for these creaky, crackly, crumbly feeling of the grinding sound in your knee that's starting to affect pain or cause pain? The number one, first and foremost thing I would recommend, the tried and true, is exercise. Lose weight. If you're overweight, and what is it, some 76% of us Americans are, if you're overweight, do all you can to lose weight. Whole other topic on that, but I would seriously look at your diet. Look up on my YouTube. I have lots of stuff up there on how to lose weight. Diet is probably going to be 70% of that. But exercise is really, really critically important too. Just moving the knee, kind of a catch-22, because for a lot of people it hurts to move, it hurts to be on it. But just moving it will help lubricate the joint as well, get the muscles stretched out, etc. So before you exercise, make sure that you do some gentle stretching of the knee, and that you do some warm-up of the knee as well. So I wouldn't recommend just going out jogging or running right off the bat or cycling real hard. Slowly work into that. So start out with a gentle walk and move up to a jog, of course, after you're stretching. I recommend it all the time. I love this, and that's yoga. I resisted it for a long time, being a man and an athlete and all that, but I tell you, look into yoga. It's awesome for stretching that out. They also have stretching classes, yoga classes. So if that's not helping, you're still having pain and you've tried all that, or it's too painful, and you've also ruled out other really bad things, you've been to your doctor and they say, there's really nothing in there, or even bone on bone, that cartilage is so worn away but it's not a surgical candidate, or even before you go under the knife, you really should look into cold laser therapy. It's actually been around a long time, and cold really means it doesn't feel cold when you get it, but it's opposed to hot. And hot laser is what they use for LASIK surgery or even cutting eye beams and things like that. In our office, we do have 2 cold laser units here. They work fantastic for decreasing inflammation and swelling. And that's what you're taking your Tylenol and your ibuprofen for, so that's a natural way. Number 2 is it actually speeds healing. And the way it does that is the laser actually goes down to the cellular level, stimulates the mitochondria to release more ATP. ATP is the It's the fuel of the cell, so it speeds metabolism and speeds healing. And the third thing it does is it helps with pain. So decrease inflammation, decrease pain, speed healing. Cold laser actually works awesome, works very, very well. And another technique that I employ that works really, really well is a technique called Trigenics. And I'll read their definition here. It's in the article as well. But Trigenics is an advanced neurological muscle assessment, treatment, and training system which instantly reprograms the way the brain communicates with the body to immediately relieve pain, amplify strength and movement, and augment muscular performance. And I've been using this for years, and this technique is phenomenal. It's unbelievable. I've had people with bone on bone. Take the x-ray and there it is. It is, the bone is on the bone. I've had people scheduled for knee replacement surgery cancel the appointment because it's no longer needed. I've had people with surgeries, and I've done treatments of Trigenics and laser and a few other things and seen them come out of pain. So they're thinking, geez, I'm going to have to get my next knee surgery. You know, they say they only last 5, 6, 7 years, and it's been 8 years. I just know I need to have it. I said, well, let's just give this a try first. So that's just my thought. If you're waiting for your knee replacement or you're waiting until it gets bad enough, don't wait. Try out cold laser therapy. Try out Trigenics therapy. Give us a call if you're interested and you want to learn more about what we do for the knee, particularly the techniques that we talked about. Call our office. It's 434-977-5433, or shoot us an email if you're interested. We're always doing either workshops, or feel free to contact us. I can do a consultation on the phone. We'll need to examine it and see if you're a good candidate. So I hope this has been helpful with your chronic knee pain, and I look forward to seeing you in the office or out on the community, running, jogging, walking, swimming as soon as possible. Have a great day.